Back in 2012, President Barack Obama declared September as Childhood Cancer Awareness Month. Today, we honor that call by shedding light on the struggle faced by so many children around the world. To secure the future of the children, we must prioritize their well-being and stand by them, ensuring that no illness hinders their dreams, whether big or small. I am Nicole Trinidad, and I welcome you to today's episode of Lifeline, the show where we improve our lives by feeding our minds. For today's episode of Lifeline, we welcome Dr. Flerida, who is a pediatric hematologist-oncologist, and Dr. Cherry, a pediatric surgeon. Welcome to Lifeline po, Doctoras.
I'm happy to speak about childhood cancer this session, which is very important for the families and the community.
May I ask again, how are you doing? Because personally, I'm feeling a bit under the weather po. How about you naman?
Well, I'm good. This is my second time actually, so this isn't new to me. Thank you.
It's new to me.
Ayan. So thank you so much for being here with us po. And I hope everyone is also doing well today because we will talk about one of the most important health issues affecting children, which is the childhood cancer. So to spearhead our discussion po, let's start with Dr. Flery. How do childhood cancers differ from other types of cancers po?
Childhood cancers are very different from adult cancers. They usually are not related to lifestyles such as smoking, diet, or chronic exposure. Childhood cancers are usually fast-growing cancers, and they usually arise in developing tissues like the blood, the brain, the bones, and kidneys, and we call them embryonal tumors. The good thing is, childhood cancer in children actually respond well to treatment, unlike adults, and childhood cancers can be curable.
So it is really important po to really know the distinction kasi the manifestations as well as the causes are really different po pala. What cases po does surgery become the only treatment option for childhood cancers?
When already diagnosed, we can already assess if it's resectable or unresectable on diagnosis. Then if it's resectable, then we recommend surgery. It also helps that we have the multidisciplinary meeting together with our hematology oncologist, the pediatricians. Sometimes we need intensivists, radiation oncologists, and all other specialties who we think that can contribute to the treatment of our patients. Before that, we can discuss which steps to go first. So, example, we can do outright surgery. Is it chemotherapy first? And then we can also plan for future. And in this way, we can explain to parents very well and clearly so that they could accept early on the treatment.
Yan, we understand po. And thank you for that, doctors. Pero this as a final question for today or for now, what early warning signs should parents be aware of that might point to childhood cancer? So that's a question for the both of you po.
For the warning signs, I have mentioned earlier that each of the cancer in children has unique warning signs. But parents should remember that symptoms or signs that are persistent and unexplainable should raise a concern. For example, bleeding or pallor, persistent fever, or what Dr. Cherry has mentioned, lumps in the neck, in the abdomen, or in the limbs or any part of the body. Persistent headache, especially when associated with morning vomiting, sudden loss of vision, glow in the eye, or what we call leukocoria in patients with retinoblastoma, or unintentional weight loss, or recurrent infections, Those are warning signs that parents should know, and when they do appreciate them, they should bring the child for checkup to the pediatrician right away.
Thank you, Doc. How about you po, Dr. Cherry?
Early signs are the masses. I think you should bring them right away.
Opo, so if meron na po talagang mga nakikitang mga signs or symptoms, dapat pa-check up na po talaga agad. So for this segment naman po, moving forward, we have this mythical operations. Going to be stating different kinds of statements, and you're going to tell me whether they are a fact or myth. And after that po, you can give a brief explanation with the statements. Okay, so for the first statement, children with childhood cancers should avoid doing anything physical as it will only make their condition worse. Rest is what can make them recover. Fact or myth?
So it's a myth. We actually encourage children with cancer to engage in mild physical activity because mild physical activities like simple walking or gentle play will help improve their mood, their sleep, their appetite, and probably help them be compliant with the treatment. And of course, that physical activity should be complemented as well by rest. And so we encourage them to have some physical activity, and total inactivity is discouraged.
Thank you for that, Dr. Flerida. Now for our second statement. Chemotherapy affects children the same way it does in adults when they go through the process with similar side effects and risks. Fact or myth?
The childhood cancer treatment is actually specifically designed for children so that the side effects may be different. And of course, as I have mentioned earlier, that children actually recovers faster than adults. It's a myth.
All right, another myth. Now for our another sentence. When children survive cancer, they can forever live healthy, completely normal lives and are safe from cancer coming back. Fact or myth?
I think I'll answer that. Generally, this is a myth. Okay, meaning they can live normal lives. However, forever is a strong word. So we emphasize that whenever we treat cancer, some cancers can be curable, especially with complete resection. So they can live relatively disease-free lives. However, we should emphasize monitoring. So it doesn't mean that the treatment is done, then they could not follow up. This more or less is a lifetime goal for us to advise parents to bring their children back, or even if when they're already adults, they can always come back for monitoring.
So emphasis on consistent monitoring. Thank you for that, doctors. Now, thank you again for sharing your insights on childhood cancer. We're back. I hope you've all had the chance to catch your breath because that was just the beginning. At this juncture, we can now start with the next set of questions. So how do you help children and their parents cope with the anxiety with the surgery?
We need to address the fear that surgery will harm the patient. In fact, it's the opposite. We want to remove the tumor as safely as possible, as early as possible, and as quick as possible. So we also refer to our pediatric anesthesiologist and of course our multidisciplinary meeting, and we make sure that all these treatments are appropriate for age, appropriate for the tumor, and although there will be some side effects, most probably like pain or some let's say for the medical treatment, some nausea, vomiting, maybe weakness, we can all allay the fears of parents by explaining that there are some steps or some methods where we can minimize these problems. And of course, for the children, the younger children, they cannot understand yet what surgery is. But we make sure that when we address them or bring them to the operating room, we make sure that the environment is as friendly as possible. The people are as friendly as possible. We cannot treat them like adults because they are not small adults. They are a different they're a different population, but I think they are very resilient, and I really admire how they take all the treatments. In fact, better than some adults.
So the borderline po talaga, no, especially for parents, is to really inform them about the process and all that things that they should know about. Now for Dr. Flerida again, why do you believe lifestyle factors like nutrition, physical activity, and emotional support play a critical role in child's healing journey?
Thank you. Cancer treatment is not just about chemotherapy or surgery. So as you have mentioned, good nutrition is important because it supports growth and healing. Physical activity will improve the physical strength of the child. And of course, avoidance of activities that will predispose them to infection will keep the child out of the hospital. And the emotional support from the family and community will improve adherence to treatment. So I think if there is significant support to the family and community, then the outcome of childhood cancer will be better.
So recovery po talaga is not only physical but also emotional and all that aspect. Now to, as a final thought po for the both of you, in your opinion, why do you think Childhood Cancer Awareness Month is important?
It is important because we need to let the parents know, the community know that having cancer is not the end. It is a multifactorial, or it is something that a lot of patients go through, and all these specialties, the family, the relatives, the community can help patients go through the treatment.
Thank you for that, Dr. Cherry. How about you po?
I think this month shines the light on the importance of early recognition of childhood cancer, fighting stigma or fear of cancer, and mobilization of support to facilitate access to medicine and diagnostic tests, which are very important in resource-limited countries like the Philippines. So I think this kind of celebration will highlight that the child's life is precious, and that cancer care should include early detection and equitable access to care, and that should be the standard for every child, not just for a few.
Indeed. Thank you so much po. And yun nga po, no, parang awareness talaga also means breaking the stigma surrounding childhood cancer. Thank you once again, Dr. Flerida Hernandez and Dr. Cherry Shaw, for gracing us with your presence here on Lifeline and for answering our questions. Before September ends, it's important that we celebrate Childhood Cancer Awareness Month, where we empower our advocacies through awareness. We here in Lifeline believe that every child's life matters, and our mission is to continue providing a voice to our citizens of tomorrow. Always feel the roar by following us on our Facebook, Instagram, TikTok, X, and YouTube page at UST Tiger TV and at UST Tiger Radio. Once again, my name is Nicole Trinidad, your host for today's episode of Lifeline, where we improve lives by feeding our minds.